Hello, everyone. I'm Dr. Ayman Chit, and I head up the North America medical team for vaccines here at Sanofi. And I'm joined today with Dr. Mona Amin to speak about RSV. And it's the perfect time to do so since it's October and RSV Awareness Month, and that means the season is upon us. So I'm excited to have an expert today to talk about this topic that we're extremely passionate about here at Sanofi. Hello, Dr. Amin.
Thank you for having me, Amin. RSV Awareness Month is the perfect time to talk about how we can help protect our babies from one of the most serious and unpredictable respiratory viruses out there.
RSV is something many parents have not heard of. Why should they have this on their radar? And what do you do in your practice?
So, as a pediatrician and a mom myself, my number one priority is what I can do to help protect my kiddos and those I see at my practice throughout the year, especially during RSV season. You know, I've been practicing pediatric medicine for over a decade before RSV protection was broadly available for babies. I practiced in upstate New York as for residency, New York City, and now in Florida. So I've been privileged to work in many different communities and many different cities across the country. And so what may seem like a benign virus to an adult or an older child, this virus can cause lower respiratory tract infection, which are things like pneumonia, or you may have heard the term bronchiolitis, which is when there's inflammation of the bronchioles of the lungs. And this can impact all children and especially under one. So I know the toll this virus has historically on babies, their parents, and those who care for these sick babies. That's why I talk to every parent about prevention, especially before RSV season begins in the fall.
Thanks, Dr. Amin. So it's important for parents to know that every baby entering the first RSV season is at risk of contracting this virus. And while most of the time RSV will cause a mild cold like illness, it continues to be a leading cause of hospitalizations in babies under one. That's why at Sanofi, we're so passionate about helping protect infants. So raising awareness is critical if we want to change the story here.
Amen. I think it's also worth noting how contagious this virus can be. So RSV spreads when droplets from a cough, sneeze, or infected surface get inside the eyes, nose, or mouth. So it's not surprising that 2 out of 3 babies will get RSV by the age of 1. I make sure to discuss RSV with parents ahead of the season. For babies born in the summer, so before the RSV season, I want to make sure that they set up an appointment right when protection becomes available on October 1st. Babies can receive protection through March 31st. And while my youngest patients can get it at their first wellness appointment, prevention can also be administered at the hospital right after they're born. I would encourage expecting parents to explore their options to ensure their baby is getting the protection they deserve as they enter their first RSV season.
Yes, it's so important for expecting parents to speak with their doctor or their baby's doctor about the RSV prevention that is the right thing for their family.
Absolutely. And many families at my practice have opted for Beyfortus, nirsevimab-alip. Beyfortus can help prevent serious lung disease caused by RSV in newborns and babies under 1, born during or entering their first RSV season, and certain children up to 24 months. And your child should not take Beyfortus if your child has had a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. And see the end of this video for full safety information, of course.
You mentioned how parents are landing on the fact that Beyfortus is the right decision for their family. Can you speak to how that has impacted your practice?
So I work for a very large practice that has over 40 offices, so 40 locations under the umbrella of a big practice. And so far we've given to date over 1,800 doses of this antibody. And like I said, parents want to help protect their babies, and they're grateful to have an option and will help protect their baby through the RSV season. Also, Beyfortus is the only recommended option for high-risk infants entering their second season.
I know your experience is only anecdotal. However, the level of benefit is so large that it's been fairly easy to measure in real world studies. It's not every day we're able to design and work on a product that's this impactful. So, seeing all the data from the studies has been really motivating for us, and hearing anecdotal experiences like yours is really motivating for us. Today, we've seen an impressive number of studies from around the world documenting exactly what you're seeing. Can you, Mona, tell us a little bit about I'm interested in some of the challenges you went through to be able to achieve such a high coverage. I'm sure it wasn't just like, oh, here's a product and you're able
Yes.
to just implement it right away. What are some of the hurdles that you had to overcome as a provider to get things to where they are today?
I think one of the biggest thing is having open communication and saying, hey, this is something that I recommend for your child today. Do you have any questions? Right? I think parents want to have that autonomy on being able to choose what they get to do for their child, but also know that there's someone on the other end who's willing to answer questions. So one question I often get asked is, Dr. Mona, would you give this to your children? And if my daughter was eligible, I would have given it to her. And if I were to have another child, which I'm not, I would say yes. A little more about Beyfortus. It's not a vaccine, but a preventative antibody that gives babies the protection they need before their immune systems are ready. It's backed by over 40 studies and has been used in more than 6 million babies worldwide. That's powerful. I want to remind families, because there's an often misconception here, that by getting this antibody, it doesn't mean that you cannot get RSV. Your baby may still get RSV, but what it's helping is reducing that risk of lower respiratory tract infection, right? So the pneumonias, the bronchiolitis, and that is an important thing to remember. And so for clinicians, be transparent, explain how this works. Parents want to know, they want to learn, they want to feel like what they're putting into their child's body, that they have a say. So have those open roads of communication and really know your information so that you can better educate your families.
Yes, and Sanofi is working hard to make sure every baby has access because all babies should be protected.
Exactly. My message to parents is simple. Ask your pediatrician about Beyfortus before October 1st. It's one of the most important decisions you can make to help protect your baby this season.
Thank you, Dr. Amin, for your leadership and for being such a strong voice for families. And thank you for every parent watching. Your baby deserves protection, and we're here to help make that happen. Please stay through the end of this video for important safety information about Beyfortus.
Important safety information. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Before your child receives Beyfortus, tell your healthcare provider about all of your child's medical conditions, including if your child has ever had a reaction to Beyfortus, has bleeding or bruising problems. If your child has a problem with bleeding or bruises easily, an injection could cause a problem. Tell your healthcare provider about all of the medicines your child takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Your infant should not receive a medicine called palivizumab if they have already received Beyfortus in the same RSV season. Serious allergic reactions have happened with Beyfortus. Get medical help right away if your child has any of the following signs or symptoms of a serious allergic reaction: swelling of the face, mouth, or tongue, difficulty swallowing or breathing, unresponsiveness, bluish color of skin, lips, or under fingernails, muscle weakness, severe rash, hives, or itching. The most common side effects of Beyfortus include rash and pain, swelling or hardness at the site of your child's injection. These are not all the possible side effects of Beyfortus. Call your healthcare provider if you have questions about side effects. Indication: Beyfortus is a prescription medicine used to help prevent a serious lung disease caused by respiratory syncytial virus, RSV, in newborns and babies under 1 year of age born during or entering their first RSV season. Children up to 24 months of age who remain at risk of severe RSV disease through their second RSV season.